My name is Nina Wallerstein. I'm a professor in the College of Population Health and the director of a Center for Participatory Research.
Very pleased to interview you. And could you please introduce yourself and tell us a little bit about your role at UNM and the work you focus on?
My name is Nina Wallerstein. I'm a professor in the College of Population Health and the director of a Center for Participatory Research. And my major area of focus has really been what is community-based participatory research? What are good partnership practices that universities and investigators should engage in? How do we support the leadership of communities to prioritize their own research, to tell us their needs, their strengths, and how do we build knowledge creation with a partnership approach rather than a university approach. So that's what I've been doing for many, many years.
So you spent over like 4 decades developing community-based participatory research and working closely with communities. What first inspired you to pursue this kind of work?
So early in my work life, I was actually an adult education teacher. And I taught adults English as a second language with a methodology from Paulo Freire, who's a Brazilian educator, a liberatory educator, believing in the knowledge that people themselves have. So when I managed to move into the research arena, I got my master's, then my doctorate in public health, I kept this idea that people in communities really do know what they're offering. They have knowledge, they have values, they have history, they have their whole context. And how do I, as a researcher, honor that? So I kept this idea from Paulo Freire always, that it's important to base the work within what the community needs and what the community prioritizes. So that shaped every kind of research that I started in. It shaped my dissertation. It shaped my work with the state health department. It shaped my work with the tribal communities that I started working with. It shaped my work in Latin America. It shapes my work nationally still with community-based organizations all around the country. It just shapes my work that communities have the knowledge to contribute to the knowledge creation process because they already do create knowledge. And how can I, as a researcher, with the skills that I have, meet them halfway? And that's been my goal always as a researcher.
Looking back to early in your career, is there a particular experience working with a specific community that taught you something important, something that has stayed with you throughout the years?
Well, early in my career is my dissertation. So I was working in a program called ASAP, Adolescent Social Action Program. It started as Alcohol Substance Abuse Prevention Program, but then we took the ASAP word and we made it Adolescent Social Action Program because the kids, the youth themselves, were doing actions in their communities to improve the health of their communities. So it wasn't just about preventing the negative substance abuse, it was the positive doing social action back. So I learned a lot. So my dissertation worked with kids from Laguna Acoma High School and from Rio Grande High School. So one predominantly Hispanic, low-income community. Also from Laguna, the kids from Acoma would come to LA High School. So I worked with those kids. And the whole program was about them experiencing, by coming to the hospital, the impact of drugs and alcohol and accidents on people coming to the emergency room. But it wasn't a scared straight program because we took the kids up on the floors and they talked to the families and they learned from the patients and they talked to them as people. And then the goal of the program was for them to develop action projects back in their community from learning the stories of the people that had ended up in the hospital. So we really tried to make it so it was learning from the kids. I interviewed the kids, I did focus groups, I gave them little surveys about their experience, and then I really thought about what empowerment meant to them as youth. What did the growth of their own self creation of an action project, not as an individual, but as a collective, what that meant to them as kids. So I learned so much from these kids. And the Rio Grande High School kids were different than the Laguna Acoma High School kids. I just learned from both of them. And then I wrote my dissertation, learning what they taught me.
Empowerment and partnership are central themes in your work. What does empowerment mean to you personally and beyond a textbook definition?
So I've taken on this word empowerment because it has the word power in it. And I really believe it shows that we should honor the power that comes from communities and how they can grow their own power. I hate the word, I'm going to empower you, because I don't believe that anybody empowers another. I really believe that I can work with groups of people, which I do all over, of how we can look at the conditions in their lives together and how they themselves can take on their own power. And that is done collectively. So it's not self-esteem, it's not self-confidence, it's not self-actualization. It's collectively coming together to grow their own power for the actions they want to take as a group and within their own organizations and context and communities and what's possible. So youth can have one set of empowerment, adults in different projects have other sets of empowerment, but it's within their own power base. And that's what I really believe my work is in CBPR, community-based participatory research, is to move towards that sense of really community power for their own priorities and their own needs. Yeah.
So, talking about those vast and different sets of communities that you have worked, could you tell us a little bit about the tribal communities in New Mexico and how the international partners like those in Brazil look like? What are the most powerful lessons you've learned from those partnerships?
So I'd say I was a baby researcher when I started working with tribes. I was a new researcher, and I had to learn the importance of not just pretending I could just walk into any community and say, I'm here, I now have this research idea, but I had to have the authority from the tribal council, from the governor, from the programs that I worked with to come onto the reservation. I had to be invited in. I had to begin a process where they themselves were collaboratively developing together the research. And so that learning about governance from the tribes, I've then taken to the work that I do with Latino communities, with African American communities, saying it's the same ethical responsibility. Tribes have governments and they can demand that you have set in place data justice, data sovereignty. The data is returned to the tribe. The data is returned to the programs you work with. It's their data. It's not my data. We develop it together. I bring a lot of research skills to developing interventions. I'm an interventionist. I'm a public health interventionist. I believe in developing programs that support health, support growing health, but I do it with people. So my view of CBPR is always research with. So that's what I learned from the tribes, that co-governance and their authority is important. And that's the ethical way I then work with people in Brazil. Because I've been working in Brazil since the 2000s, actually. But in the last 10 years, I've really created much more participatory research network with my colleagues in Brazil, where I've learned from the different projects I work with. So like a group up in the Amazons working with traditional midwives, or a group in Bahia, kind of the Afro-Brazilian center of Brazil, working with children and violence in the favelas and creating places for play and really collectivity of youth, working with women in the favelas in Rio de Janeiro around violence issues, because there's a lot of these issues, of course, that emerge from the community. Working with mental health issues with a whole group of working with homeless people in Sao Paulo, with the children, with shelter of only men, of homeless shelter for men. So I get to work with different projects. I've worked with an indigenous national group. We run an annual teaching institute, but we run it together all over the country so that's facilitated in different places. So it's the same process of bringing groups together, listening for their own knowledge, telling them over and over, we have to do this as a collaborative. I bring my skills and my knowledge, you bring your skills and your knowledge, and together we can form a research project of how, for example, to improve the mental health of the men in a shelter. That's a specific project. What kind of data do we need to know about the life in that shelter? How will they create an instrument? How will they help create the interviews? And then out of that data that they themselves help create, what kind of program, I'm an interventionist, intervention would they themselves help create to really improve the mental health environment of the shelter and the lives of the men who are there? So that's one example. That's what I did last year in Brazil,
Mhm.
worked with this collective there to understand their process of how they're building that research together with the social workers, educators, with the cook of the shelter, with not just professionals, but with the cook of the shelter, and then involving some of the people living there themselves.
Okay. And with those communities, did you have any finding or surprising fact or way of doing things that you would like to bring back to the way we do things here?
The important thing that I've been learning in Brazil is long-term commitment. It is one of the major principles that Israel et al., colleagues from Detroit, Michigan, have written about the importance of long-term commitment with communities. But I've seen it over and over in Brazil now. Actually, in our tribal communities, we've been working with some of our communities here since the late 90s. And they're themselves now the coaches, the facilitators as we disseminate our intervention out to other tribal communities. Our tribal research teams that we've been working with for a long time. So it's a same learning of the importance of long-term commitment where people keep honoring each other by staying committed. Of course, I have a longtime mentor of mine who recently passed, Loretta Jones from Healthy African American Communities, Healthy African American Families in Los Angeles, who said in CBPR or community engaged research, people get on the bus and sometimes their lives take them off the bus, but they can come back to the bus. So you just have to keep that open process going. Long-term commitment is more to the place and to the community. And some people are active at certain times, and some people, sometimes they can't be active. So it's that commitment. So I've learned that both places
Mhm.
from my work in tribal communities here and my work with my Brazilian colleagues who have that kind of long-term commitment. And sometimes a student coming from a new project at UNM, they only have a year, or but they can join a project and as a learner, and then they contribute their own knowledge as well. So of course, not every project is long-term commitment either. And you just have to think, well, what's the ethical responsibility? Even if I can't do long-term commitment, I can leave the data I collect back with my community partners, even for short-term projects. So kind of developing these ethical principles for long-term and short-term. I, of course, believe in long-term commitment, but if you can't do that and students come in and out, and our university is moving in that direction of supporting more community engaged education, community engaged learning, community engaged research. So that has to allow for students also.
Okay. Building strong, lasting relationships with communities can take time and trust. What do you believe that makes a partnership truly successful?
Well, I actually believe there's in our data that we've collected from over 400 partnerships across this country, federally funded research projects, we learned there are really two pathways of success. One is showing up, the relationships, trying to listen carefully, trying to have processes of allowing with conflict comes, how do you resolve it, just the relational aspect. The other is structural, building agreements, having the idea that you share dollars and budgets with your partners, having the idea that you share and you work on a set of shared values. So it's all those agreements are more structural. And I think we need to do that more on our campus, really honor. Sometimes we think it's all just being a good person. It isn't, of course, we like to be good people, but it isn't just being a good person. It's also establishing agreements so that there can be trust built in by knowing that we are only going to publish together. You're not going to take my knowledge and publish yourself. I've never written an article with my tribal about the tribal data without tribal partners also as co-authors. Of course, that demands all kind of agreements. You got to go to the tribal council for approval. You got to go to the tribal IRBs for approval. You got to go sometimes to the governor or whatever leadership for approval. It takes more time to publish, to co-publish, but that's my agreements I make with my partners.
Wonderful. Um, as in any other aspect, challenges are part of any meaningful work. Could you share a time when a project didn't go as planned, and what did you learn from that experience?
So I have been invited to come and do some work with certain tribes because they think that it would be good if I brought a certain process. One process I was working on was how to assess and analyze a public health infrastructure in tribal communities. So I was adapting an instrument from the Centers for Disease Control and worked successfully with one tribe on adapting it and going through a whole process. Somebody from another tribe thought, or the Pueblo thought it would be helpful to them, so brought me there to work with another team that this person had created. And nobody, it didn't grab anybody. It wasn't interesting. They had other priorities. This one person had invited me, who was a prominent person in the community, but I kept going, because sometimes you just have to show up and say, this is what the process could be. But it wasn't an idea that came from them. It came from one person because I definitely was invited, but it wasn't an idea that they wanted to do. So it really became apparent that this wasn't going to happen. And so we had to kind of figure out a way to part ways. And I had to kind of have a way to say, I'm not abandoning you. It seems like you have other priorities. So yeah, it didn't work. But that kind of reinforced for me again, what does it mean to be invited? Who's inviting you? Is it a team? Is it a group? Is it just a single person? Sometimes that works. And sometimes things grow very slowly. And if you're willing to wait it out, sometimes it works. But you also have to know when to say it's not working. And yeah, I had to decide this isn't working. I talked to the person who invited me and said, I know you're prominent here, or you have this position of privilege, you have this position in the community, but it isn't working. So let's figure out, maybe you should go on to some of the priorities that they've also identified, the group but that isn't my issue. So maybe find someone else that you might want to work with. So, you never just leave abruptly. You have to kind of also, if you're going to have a process ending, you have to also be able to have that dialogue of why or what's happening, or so that they can go on and with the capacity, hopefully you've left some knowledge and skills that they can keep using. I mean, that's a hope that you always want to be part of leaving something.
Yes, and again, talking about challenges, could you tell us a little bit how national funding agencies continue to evolve and how this impacts your work in community engagement?
So there's been always an up and down process. The first national funding of community engaged research in the National Institutes of Health was in 1998. So that's quite a ways ago, but different institutes, that was from the National Institute of Environmental Health Sciences, and different institutes took it on and others never took it on. Other funding sources, the foundations have felt this has become really important, community engagement. So that's really positive. Community engagement is now still going on, but funding in our current national environment is being cut dramatically in the Centers for Disease Control and National Institutes of Health, National Science Foundation, which affects many people on main campus. So it's affecting all of us. So we have to figure out how to keep the work going, even in this current environment of cuts. Now, again, I'm a firm believer that engagement is going to stay. And engagement, whether it comes in different forms, and I know the Carnegie Foundation has been supporting engagement. AAMC from the medical colleges is definitely continuing to support community engagement. So professional associations, foundations are continuing to support community engagement, but it's not been a straight, beautiful, linear process. I've seen it come up and down, and I just know, I think the best part of this is if community groups and tribal leaders maintain how much they demand to be engaged, and even more than engaged, in the lead of research. So my current PCORI project is all about developing and strengthening patient and community engagement in a leadership role, not just in a responding to an academic role. How did they set the priorities? How did they set the demands? How did they help set the research design? How did they help set the sample, the process, the interviews, the survey instruments, whatever is happening? So that is my current project, which I still believe we can continue to do. We're funded by the Patient-Centered Outcomes Research Institute, and that's positive because we're still in a good operating mode.
Yeah, that's great. Um, your work focuses on achieving health equity, which can sometimes feel slow and complex. What keeps you grounded and motivated over the long term?
Probably my relationships. I maintain that it's not just relationships, it's also the structural agreements as best practices. But probably because I have good friendships, I have good connections, I show up. One person taught me a lot by saying, this was Professor Northrup she
Mhm.
was the editor of the Journal of Public Health. And she said, you know what CBPR is, or community engaged research? It's just three things. It's knowing how to listen and listen and listen. It's showing up. It's just showing up in communities. Don't expect people to come to the university. It's showing up. And the third is just believing in social justice, having a value base. That's all. That's her best practices, which I hold very dear to me. So I know that equity is a forever goal. I know that social justice is a forever goal, but showing up builds those relationships of friendships and commitment, and listening keeps the learning. So as scholars, we are learners. So if we're co-learning all the time, that keeps me going. And, it's hard when funding ends. It's hard when a project ends. How do you keep the relationships and the learning going? Because even if funding ends for a project, the learning continues. And that's what research is all about. To me, research is only about systematic learning. So that's my definition of research. You apply all these methodologies, which we all do, or designs, which we all do, but it's only about systematic learning. So how do we keep the learning going, and how do we keep the relationships going? That's what keeps me going, because the long goal, we're never going to get there. And I have another mentor, Miles Horton from the Highlander Center, who says, if you believe you can reach your goal, then it's the wrong goal.
Wow. Okay.
We
And
take from our mentors. We always need to take from our mentors.
yes. Well, talking about that, like if you cannot reach your goals, uh, and also the aspect about listening and like actively listening, which is characteristic of some of the communities that you've been working with. Is there any other story, tradition, or value that left a deep impression on you personally?
Well, one of my most important times was after I had been working with one tribal community, probably for 5 years, on a project that we had agreed on together. So we were working together, and we were at the moment in a room, in a conference room in their community, and we were putting on the whiteboard, the whiteboard, things that we wanted to publish together. What are the learnings that we wanted to publish? So we were kind of creating an article. I'm pretty good at this, I know the scientific literature. How do you create an article? And so I was giving them all that. And somebody turned to me suddenly and said, Nina, what are you doing here anyway? Why are you even here? it was like a shock. I had been working with this group for 5 years. But it was the first time that someone asked me honestly, why are you here? So I was flustered, of course, but I did say, I'm here as a learner. I'm here as someone who has benefited. I myself have grown a whole lot by your willingness to have me in your community. It's an honor for me to be in your community. But I'm not even sure that was enough for this person. But that's the only thing I could say is I myself have learned, I've benefited, and I thank you for that. And so, but it took 5 years to be asked the question. Sometimes we think we're good friends, we know each other, it's a relationship, but to have a really direct, honest, are you sure you want to be here? Get out. No, nobody said that. But just, why are you here? Tell us directly. Why are you here? So that stays with me all the time, that question.
That is a question I think we should all make ourselves. That's wonderful. And in the same line, what is what you feel most proud of in all your trajectory experience, different experiences?
So I feel most proud of that I've been able to maintain relationships and kept the work going over time in many communities. And I'm good at grant writing. So I can keep resources. One of the things I think about as someone with privilege, with power, I have a degree, I come from a middle-class Jewish resourced family that fostered education. I have that privilege, I have that power, that I can use it in a good way. So I'm proud that I can try and use the privilege I have to create or to be with people in an authentic partnership. But I know what I can bring and I don't hide it. I'm who I am. And so that's been important to me, that I can bring my privilege and power. I don't have power in every dimension of my life, but I do often as an academic can bring resources in. So I'm proud of that. And I'm proud also, I should just say one of the research agendas that I'm most proud of, in addition to learning from my Indigenous tribal partners, is this long-term trajectory of Engage for Equity, which since 2006, we have been investigating the role of best community practices, best partnership practices to produce outcomes. And we've been able to have 3 stages of NIH funding, 2 stages of PCORI funding to really look at and analyze. It isn't just walking into community, but to analyze and work with best practices. So I'm proud of that. We've published, we contribute to the literature. We have national partners. I'm proud of my national networks. So I'm proud of that. And I'm proud now that we're now investigating how institutions, universities, academic health centers, different departments, colleges can really change or transform our own policies and practices to better sustain the strength of community engagement. And community engaged, for me, research. I do community engagement in my classes also, but I do consider myself first and foremost a community engaged CBPR, community-based participatory researcher. And so I'm proud of this Engage for Equity lineage since 2006 and working with different organizations and universities and community groups across the nation.
And for students or emerging researchers who want to work in community engaged research, what advice would you offer?
I would advise students to try and find a project that they really either bring themselves and have really strong passion about, or connect with a mentor where they can be a learner and contributor, because it's hard in a small time frame of a semester or even a year or even a doctoral dissertation of a number of years. It can be hard to develop a new partnership and conduct research with that new partnership. So to join projects for sure, or to find a way to have support for a passion that you bring. because there are a lot of faculty who would provide support for a student with their own passion and might be able to provide resources of a different, this is an agency to connect with, try to connect with this person. So to be as much open to being networked, and because the networks exist, the networks do exist for students. And we need to strengthen them, of course, but they do exist.
And finally, as a current member of the Community Engagement Advisory Board and a champion for community engagement, where do you see the future direction of community engagement heading? You can also tell us about your work in the community engagement academies.
So I think it's part of my current PCORI award, which is we need to look at ourselves as an institution. So I think my role in the current community engagement committee and then community engagement process at the University of New Mexico is to try and strengthen UNM's policies, practices, and that includes faculty committed to community engagement, whether it's in their classes or in research. And so we've been talking about developing a community academy for faculty to strengthen their own learning and their own, what they bring, the passion they bring, and how to then maybe support their direction into being mentors for students, to being more adept at their own research and community engagement, to learn the best practices that exist, a lot from my work, to learn the best practices of community engaged research and community engagement, because it's not just research, community engaged practice. So there are these best practices we've uncovered, other people have uncovered in other disciplines. So how do we bring those together in a community engagement academy, which I think my Center for Participatory Research has a lot of the resources and strengths to be a leader in this. And so I look forward to continuing that role within our own institution. But it is part of this whole research I'm doing now with 8 universities across the country to say, how can each university get stronger in supporting community engaged partnerships? So it isn't just based on a single grant that someone has or a single project, but that the university supports it, which is part of the Carnegie Fellowship Scholarship as well, Carnegie Foundation designation for a community engaged university. So I think that we're on the right path at UNM.
Well, actually, I have another question. I don't know if you want to talk about it, about your CBPR Institute. Would you like to say something about it too?
So my Center for Participatory Research has been running a community-based participatory research summer institute for 16 years. We are entering our 17th year. We have close to 700 participants over all these years from UNM, from around the country, even international folks come in. And it's an opportunity for really people to think critically about how to strengthen their work in their own passion, in their own research agenda. And we have community partners, we have students, we have faculty, we have fellows, we have clinicians, we have people who come from all walks of life. And so it is always around Memorial Day. We welcome you in the next year, but it's full at this moment for our current institute. So we continue the training that we've been doing and it comes out of our Center for Participatory Research and our College of Population Health.
No, and the last question, could you tell us a little bit about what do you see is the role of the Office of Community Engagement at UNM?
So the Office of Community Engagement under the Provost's office has finally been elevated, I think, to an important role, not just for satisfying the application for the Carnegie designation of a community engaged university, but for really making a difference at UNM. To say that every discipline, whether it's social science or humanities or fine arts, or of course in my role in public health or in medical science or nursing, that we all have a role to strengthen community engagement. And the office under the Provost's office has the bandwidth, we hope, to be able to do that. I'm also, of course, offering my own Center for Participatory Research as a good partner to this. There are other centers that are also partners. So we need to kind of show that the office under the Provost's office can help lead this partnership development even within our own campus. My name is Nina Wallerstein. I'm a professor in the College of Population Health and the director of a Center for Participatory Research.